Okay, I'm back. Yes. Okay, thank you very much. I hope that you heard me say that Dr. Katrina Chance is who I am introducing, and that it's my great honor and privilege and pleasure to introduce Dr. Chance, who is a wonderful colleague and partner in the Smart Start Network, and someone I'm just thrilled that I've gotten to know, and a friend, which is wonderful. So Dr. Katrina Chance will be the moderator of the panel, and she's executive director for Richmond County Partnership for Children, a Smart Start partner whose mission is to advance a high quality, accountable system of care and early education for each child, beginning with a healthy birth, support families to improve early childhood health and development, and ensure children are prepared for success in school and in a global community. Dr. Chance began her career with the United States Army in Texas in 1990, gaining unparalleled leadership experience. She also served our country in Alaska and Georgia. Dr. Chance had a family childcare business, worked as a deputy director for Head Start and an assistant director for Child Care Resource and Referral, an agency, resource and referral agency, establishing herself as a respected early childhood and education professional. She has a bachelor's degree in social science with a focus in human development, a master's degree in organizational management with a specialization in leadership, and a doctorate of business administration. She also holds a family service credential. She is of utmost pride, has utmost pride in her start in education from attending Head Start in rural West Texas, as well as being an Army brat, a veteran, and a mother of an active duty female soldier. Katrina is also recognized for her ability to build effective teams, coordination, and supervision of multiple activities, and for her expertise in child development and parent engagement. Recently, she was selected to participate in the 2021-2023 National Black Child Development Institute's Policy Fellowship Program. And we are very proud of that, and also that we have two folks from the Smart Start Network represented in that class. So without further ado, I will turn it over to you, Dr. Chance.
Thank you so much, Madam President Cubbage. I thank you so much for your work and your leadership, and also for your team for asking me to moderate this session. As it is the last session of the day, and we know that when it comes to the last session of the day, the last time, what I know, we get down to the last session and everyone gets tired. So if you take a look in your chat, there will be a sweet treat for you. For those of you that may be weight conscious, you may find a healthy sweet treat for you. So just take a look and you will find something sweet in there for you, okay? So our panel description today for our panel, the panel will explore the connection between North Carolina's home visiting and parenting education models, and how each works on their own and collaboratively to serve children and families. Panel representatives are from the home visiting and parenting education models, which include Circle of Parents, Incredible Years, Parents as Teachers, Nurse Family Partnership, Healthy Families America, HealthySteps, and Family Connects International. So we welcome all of our panelists from all over North Carolina. And at this time, each panelist will have the opportunity to introduce themselves, and then we will dive into our questions. So at this time, we will actually start our introductions with Ms. Stacey Cunningham with Prevention Program Specialist. She's a Prevention Program Specialist with Circle of Parents.
Thank you, Dr. Chance, and good afternoon. My name is Stacey Cunningham, as Dr. Chance said, and I work with Prevent Child Abuse North Carolina, and I am part of the Prevention Programs team. And I am here today to talk a little bit about Circle of Parents. Which, Dr. Chance, would you like me to give a little bit of background about
Yes, so what
Circle
the
of parents
first,
as well?
so what I'll go ahead and once I call your name and then we'll go ahead and dive into the first question. And after that, then we'll rotate our questions. So the first question is, what do you find as a strength of your home visiting and parenting education model?
Would you like for me to start with that question?
Yes.
Okay, so I would say specifically with Circle of Parents, there are a couple of things that I'll mention. One is the fact that it is a peer support model. So it's parents coming together to support one another. I think the setting, something that's unique to Circle is the setting, and that it's non-judgmental, and that it promotes positive parenting. So I see all of those as being strengths of the Circle of Parents model.
Thank you. Thank you, Ms. Cunningham. Next, we'll have Ms. Hicks, Ms. Monica Hicks.
Good afternoon, everyone. I work with Stacey at Prevent Child Abuse North Carolina. I work with the Incredible Years. I'm one of the prevention program specialists, and we support the Incredible Years. And for those of y'all who don't, maybe aren't as familiar with the Incredible Years, it is a parent education program, and it is group-based. And it is for children really from ages, they have lots of programs for the younger children, but today I'm kind of talking about 3 to 6, so preschool age, and older children ages 6 to 12. And the purposes of the Incredible Year parenting program, is to really encourage social and emotional competence in children, get them ready for school, help with parent-child interactions. So any of those things would be a great resource for parents. Some of the strengths of the Incredible Years, which I think are worth noting, are that the running of the group sort of it's a lot of different varieties of activities to sort of get the teaching, get parents involved in the teaching. So videos, role practices, or we call them behavioral rehearsals, a lot of collaboration with facilitators and parents, and encouraging parent problem solving. So those are some of the big ticket items in terms of strengths of the Incredible Years. Thanks.
Okay. Thank you. Let's see something in the chat. Ms. Carter, can you hear me? Okay, that's just.
Yes, I'm just posting the descriptions of each program for attendees.
Okay, I was having technical difficulty. I'm just making sure that I'm not having some difficulties here. Okay, next we have Ms. Learman, Ms. Patti Learman.
Good afternoon, everybody. I'm Patti Learman with Parents as Teachers, North Carolina Parents as Teachers. Parents as Teachers, if you don't know, is an evidence-based home visiting program that offers personal visits virtually right now. We also do group connections and developmental screenings and resource connection. When I think about what the strength of Parents as Teachers is, I think about our approach, and that is to partner, facilitate, and reflect with the parent, or the guardian. When we talk about partnering, we as parent educators, we step out of the spotlight and let the parent be in the spotlight and the one that's in charge of what's going on and what's going to happen in a visit, and they help participate. They participate by helping to plan the visit. And then the facilitate piece of that is the work that we do, bringing them information about child development or parenting, whatever is going on at the moment. And then the reflective piece is to help parents really understand their impact in the relationship that they have with their children, and think about what it is that they're doing and how it's impacting them. So all of that leads up to what we all know is the secret sauce, and the work that we do is building relationships. So we can't have this approach without a relationship that naturally develops into a helping relationship with our families.
Thank you, Ms. Patti. Next, Ms. Amanda.
Thank you. Good afternoon. I'm Mandy Leigh. I'm one of the Nurses Family Partnership State Nurse Consultants. And Nurse Family Partnership is an evidence-based home visiting program. We enroll the mom early in pregnancy before the 28th week, and we continue to visit the mom until the infant turns 2, doing home visits. One of our biggest strengths is that our home visitors are nurses, so they bring with them the health and education experience for assessment, and along with all the other many hats that they wear. Some of the other strengths that you've heard from the other home visiting programs already is that we're relationship based. We focus on the mom's strengths and what her heart's desire is.
Thank you. Okay, and our only gentleman that's in our group, and we know that men in our field are jewels. Since we only have one on our panel, I brought another one so that there's more than one in the room. So Mr. Mark, you're up.
Thank you. Good afternoon. I am Mark Ownbey. I am the Healthy Families America State Consultant with the Maternal Infant Early Childhood Home Visiting team with Division of Public Health. Like Mandy mentioned and other folks, Healthy Families is really grounded on that relationship that the family support specialists build with their families. And it is the family's desires and goals for themselves and their children that really drive the services during home visits. Healthy Families America is a long-term program, so we will serve families through 3 years old, and a couple of programs will serve them through 5 years, so that they can make that transition into kindergarten. And the thing that sticks out in my head when I think about Healthy Families, and I've been affiliated with it for over 20 years now, is that it works. We really see a significant impact in both the life of the parent and the life of the child. The research shows that. And I've been around long enough in the same community. My wife started the program here in Burke County years ago. And we still run into those folks. And those first kids are now in college, some of them. So they can't even imagine the difference in their life from where some of their parents were when they were born. So it's really that just keeps me sort of energized about the whole thing, because we just see those positive impacts in so many ways with kids and families. Thanks.
Thank you. So building those relationships, continuing to make those connections, even though some of our children do age out of our programs, but still having the opportunity to maintain those connections. Very good. Thank you so much. Miss Jessica.
Yes, good afternoon, everyone. I'm Jessica Reinholz, Program Director for Family Connects International, and I support the North Carolina programs that are piloting in North Carolina. So Family Connects is really unique because we're an evidence-based model that's universally provided. So within a catchment area, we provide home visits to all births within that catchment area. And we provide the visit at 3 weeks postpartum, so at a very critical time, both for the birthing parent and for the newborn. And it's right around the time that ACOG, the American College for Obstetrics and Gynecology, recommends that there be a check both on the birthing parent and on the newborn. So we go into the homes, we're virtual right now, and we assess both the health and the social needs of the birthing parent and of the newborn. And we have a really strong community focus. So we build a robust list of resources. We have a community advisory board that links us to resources and helps provide a coordinated system of care. And we also are able to bubble up from the families some of the issues and gaps that we're noticing across those families to leverage for systems change. And something that's important that maybe I didn't mention before is that this is provided by a nurse. So there's a trusted nurse professional that can assess the health and well-being of both the birthing parent and the newborn.
Thank you very much. Next, we have Miss Natalie, and then after Miss Natalie, we'll have Miss Sara.
Good afternoon. Thanks, Dr. Chance.
You're
Yes,
welcome.
my name is Natalie Tackitt. I'm the North Carolina coordinator for HealthySteps. HealthySteps is a model that places a child development expert of some sort in a pediatric serving practice. So it's, and this person is known as a HealthySteps specialist. And some of the strengths are just as everyone else. We all know strength-based is very important in nurturing the positive relationship between parent and child, or caregiver and child. One of the other really valuable sides of HealthySteps is 90% of children are brought to a pediatric visit on a regular basis. There are 12 or 13 visits that take place between a newborn visit and the 3-year-old visit. And those are the years that HealthySteps focuses on, because that's when, as you all know, most of the brain development is happening, and pediatricians are trusted. Parents trust their pediatricians. So when you introduce a child development expert to talk to parents about their healthy development, social emotional development, and building those relationships within caregiver and child, they trust the information they're receiving. We joke about riding in on the coattails of the pediatrician. Because the information is coming to them at their pediatric visits, there's a level of trust and relationship building that takes place very naturally. It's a risk stratified, population-based program, so families who need more get more, as well as Jessica said, the Family Connects team does, building those referral systems as well, making sure that families get connected to resources in the community is another strength of HealthySteps.
Thank you.
All right, and I think I'll round it out. I'm Sara Vandriel. I am an implementation consultant with Triple P America and support the Triple P work that happens in North Carolina amongst many other partners, including Prevent Child Abuse North Carolina and the Impact Center at Frank Porter Graham, and many of our funder and leader partners. But Triple P is a evidence-based system of interventions. So we don't just have one particular program for families, but we have over 20 different programs for families that vary in intensity of support and vary in formats, from groups to individual to virtual delivery to online modules, with really the idea of supporting parents with concrete positive parenting skills that help them build relationships with their kiddos and then help their kiddos thrive socially, emotionally, and behaviorally. I gotta say, going last in this panel, like there's so much synergy amongst many of the things folks said, being strengths-based, really making sure the parent's the expert, they drive the goals. I really love hearing the synergy amongst, the different programs that are here for families. Maybe just a couple of the things, for Triple P, just to round it out. The programs we do have programs for parents at kids 0 to 17. So it kind of crosses the developmental age span. And then we do have, as we mentioned, different intensities that are offered through different providers in the community. So who provides Triple P in the community is based on kind of who that network is within the community. So we have a very wide variety of different types of practitioners that provide services to families in the community. So back to you, Dr. Chance. Thanks.
Okay, thank you, Sara, for bringing up the rear on that one. Okay, now here we go. So what are some challenges you face as you work to support children and families? Okay, thank you. Okay, so we have Miss Jessica, and after Miss Jessica, we have Miss Stacey.
Certainly, yeah, I'm happy to share. It's so exciting to see all of us here together to talk about the continuum of care. I will say that the challenges that we have faced are kind of a couple of them I'll share. One is that a universal program is a little bit of a paradigm shift, particularly if providers or nurses or the agency that's providing Family Connects is used to providing a more intensive program or a case management program. Providing a universal program that's not necessarily needs-based, but that is offered to everyone regardless of income or other need is a shift. But we tend to leverage that we do tailor our services for the families based on their needs. So we're both trying to meet the needs of those who have greater need, but also offering it universally to destigmatize accessing services and needing care at such a pivotal time. The other is just in the COVID landscape, recruitment has been really difficult. Normally we recruit on the hospital floor, but we've had limited access due to COVID and wanting to limit exposure. So we've had to be really innovative in how we do recruiting and also how doing the virtual visits themselves as an adaptation.
Thank you very much. And if we have time, that we could circle back to recruitment, because I know recruitment is an issue that many of us have faced out in the field for our different programs. So I'd like to circle back to that one if we have time. Thank you so much. Okay, Mark, and then Stacey. I think you're on mute. He's going to let Stacey go and then we'll circle back. Thank you, Mark.
Okay, so I would say with Circle of Parents, part of the challenges that we've seen with the folks who are implementing, so facilitators and parent leaders, a big part, as was mentioned, is the recruitment piece. And I think part of that has to do with the transition that we've made to virtual delivery. And so, in addition to most of our Circle of Parents groups being offered virtually, there are a lot of folks out in our North Carolina neighborhoods and communities that just really don't have the Wi-Fi or the capability of logging in to participate. So I would say that has been a huge challenge for many of our Circle of Parents groups across the state and really across the country. I would say, in addition, Circle of Parents, the model supports a parent program and a children's program. And as you can imagine, with virtual delivery, the children's program is really difficult to implement. And so that piece has been a big challenge to the agencies that we work with and support with their implementation of the full program.
Thank you. Okay.
Yeah, the challenges Healthy Families programs have faced are similar to everybody during COVID. That switched to virtual visits and trying to decide when it's safe to go back into homes is always a moving target and continues to be. But there's some challenges that were there pre-COVID that I am really happy about the home visiting and parenting education system work going on in North Carolina. I think it's going to help address some of those. Two that really sort of stand out head and shoulders above the rest for me are, one, just the pay that home visitors and parent educators make. And as a group, they are such dedicated folks because, quite honestly, some of them can make more going to work at a fast food restaurant or Walmart or other places like that, but they have continued to stay engaged in supporting their families throughout COVID. And I just am in awe of that dedication every day when I get together with the folks I work with who are there on the ground in their communities. And the other challenge for Healthy Families is, because we are such a long-term, intense program, we start meeting with families weekly, and that changes as families are in the program longer, up to, there might be 3 months between that first and last meeting by the time folks are getting ready to graduate from the program. But other community agencies that might be connected with the family really tend to look sometimes at the family support specialist as sort of almost their employee. They have a lot of expectations that they put on home visitors that can be difficult for them to sort of balance and explain and educate with the other community agencies how we integrate in those roles, so that we're not duplicating services, and so that they also understand that we don't function as part of their agency, and there are certain roles that we are not going to take up. And so there's a continued community education piece that folks have to deal with out there in the field a lot of times.
So then it's having the consistent communication with other partners so that there's no exhaustion for the families, right?
Right.
Okay, thank you. Okay, Ms. Hicks, and then Ms. Tackitt.
Yeah, so with, I think one challenge, of course, has already been mentioned, just pivoting. The incredible years is meant to be delivered in person, like everybody else on the panel. So switching and helping facilitators navigate how do you do a role play online? That's been, or any of the other components, showing the videos and switching back and forth. So really supporting facilitators and learning how you can adapt the model has been a challenge, one that has been taken on graciously and executed beautifully, considering most of us didn't have Zoom in our back pocket like we do now. And to sort of piggyback on that is that now a challenge after 2 years of really practicing this way, folks are talking about Zoom fatigue. So it's hard to keep, so the recruitment and the retention, keeping folks sort of engaged is something that, we're seeing as a challenge, right? Probably across the board.
Thank you.
Yes, with HealthySteps being in the flow of the pediatric practice, time and space are big challenges. Pediatric practices, as many medical practices, they don't have extra space. It's very tight. So bringing one more person in, especially during COVID, has been a challenge. And then time. It's very important in medical practices to have that flow. And pediatricians get reimbursed per visit. And so it's very important that they understand and that the practice understands how to implement HealthySteps without slowing down the flow of the practice, so that you can continue to have the patient seen in the flow that doesn't get slowed down.
Yeah. Miss Patti, you're on mute.
I'm going to piggyback on some things that Monica said and Mark said. Mark took the words out of my mouth when I was thinking about what is our greatest challenge, and it is, the level of pay for our educators, and especially now, I think Monica mentioned Zoom fatigue. It's not just with our families, it's with our providers. Our providers are in this field because they want interaction with other humans. And so they want the hugs, they want the touches, they like the cuddles when they go in to do a visit. And that's one of the things that draws them to this field. And we're telling these folks that are very gifted in that area to be on top of their technology game when that's not something that they chose to do. So, and then not getting paid in a equitable way, where it's really, the quantity of pay does not compare equally to the quality of work that is being expected from our service providers. So I think that's our biggest challenge right now, is what I see.
Thank you. So everyone has really had to make that change. And when we talk about pivot, not only pivot in our service, but pivot in learning new skills, right? And then making those adjustments, again, because of the pandemic. So thank you. Okay. Next we have Miss Mandy and then Miss Sara, and then we'll move on to the next question.
Thank you. So I'm sure I'm going to sound like an echo. So the biggest challenge for Nurse Family Partnership before, during, and now mid pandemic is pay for nurses and keep, retaining our staff and paying them what they are worthy of. So I'm not going to go any deeper than that. I think that's a challenge, and it's challenge nationwide. But the biggest challenge for us now, though, for Nurse Family Partnership, with nurses being the home visitors, is that they can go to hospitals and get huge sign-on bonuses and make a lot more money than what they're making working for us in public health. So, and doing home visiting. So it was a problem, and now it's even bigger problem. But I think something that might be a little different or has not been said yet is we actually have done really well during the pandemic with retaining our clients, which I think was very surprising to some of us, because switching from in-person to virtual, yes, was very challenging, but a lot of our home visitors have done a fabulous job at keeping their clients engaged and in the program. So what we're experiencing now is all these graduations from the program, and now we need more referrals, which is a problem because a lot of the referral sources have had all these same experiences we have had, decreased staffing, not allowed to do any in-person, visits. We can't do the outreach that we really need to do to build our referrals back up. So starting to just be creative with outreach and with our referral sources, and, them experiencing the same type of challenges we are. So I think that's something a little different that wasn't said.
Thank you. Thank you.
And I'll just chime in that Triple P has experienced many of the same challenges that everyone's mentioned to date. But maybe just to expand a little bit on, Mandy's point, but from a slightly different perspective, because Triple P utilizes folks who are already seeing kids and families in the community and doesn't have Triple P specific staff, the pandemic has caused a lot of priority shifts. So for instance, our public health partners being pulled into vaccine clinics and vaccine registrations and public health measures for COVID, just as one example. I think we all know, just as one other school systems, have had to shift what they do in a huge way. And then the turnover just amongst, staff at agencies has just meant, some of our practitioners have moved on. So between prioritization and, and the hashtag Great Resignation, there is kind of a need to, and just the personal and professional exhaustion, kind of back to Monica's Zoom fatigue professionally, and then when you have to do personal Zooms with your family because you can't connect, there's a lot going on for folks, overall. But maybe rounding that out to then say, we know that supporting parents and families is more important than ever now, in the midst of needing to do this. So just how do we balance the needs families are experiencing, with the competing demands for families and the competing demands for professionals who are offering these services. But thankful for great conversations around this with lots of partners and great people to problem solve with on that.
Thank you, which is why it's so great to have great community connections within individual counties, cities, municipalities. So, all right, so diving into the next question, how does the variety of home visiting and parenting education models promote a continuum of care? So how does it promote a continuum of care? Okay, Miss Jessica, pop right on up there, Family Connections International.
Yeah, I promise I won't be the first the next time.
You are quite, we love that.
But no, I think this is such a great question. And I think Family Connect really sees ourselves as needing to be part of a continuum of care to be successful. Because we we only see families 1 to 3 times at a 3-week, after 3 weeks of a birth. It really is important to have all these other resources and to have these intensive programs that we can connect families who have a greater need to. We've seen in our research that 94% of families need either some type of education or connection to a referral at the time of a birth of a new family member. So we really see this continuum as being pivotal to to the success of the program and being able to make sure families have what they need.
Yeah. Patti, Miss Patti, if you go next, Mark, he's going to defer to all of you ladies, and then he will go last. That's just his chivalry is not dead. That's what he's trying to let you all know.
Well, as Mark shared in our last in our session that we talked about with our programs committee, is that the work that we all do together would not be possible without all of these programs, because all of these programs have a little bit of a different way of dealing with families. And I know Parents as Teachers is a great program. I love it, but it's not the end all be all. You know, we can't do it all, and nor do we strive to. We want to have these collaborative relationships with other programs to help fill in the gaps and fill in the needs and meet as many families where they're at with what they need to be the best parents they can be. So I think I'm answering the question correctly. But I'm just honored to be in this work with so many other programs that are awesome. So yeah, next.
Thank you. Okay. Miss Stacey or Miss Sara?
All right, I'll go ahead. I would say Circle of Parents is pretty incredible because part of the model is the sharing of resources. And so it's really such an integral piece of what parents do when they come together to support one another. So it could be through sharing stories, sharing experiences, literally sharing materials, but they're able to really just talk about and get a feel for what has worked for other parents that might possibly work for them. And I think other than that, one of the real benefits of the agencies that we work for is that, or work with, they often have multiple programs that they are offering to families in order to find the right fit for any specific family. And so the agencies we work with are able to let families know what other supports they have, what other programs they offer, what other resources there are in the community. And so I think it just really speaks to that continuum of care and those opportunities to really find the right fit for any particular family based on their needs.
Thank you.
Yeah, and I feel like when you raise your hand and then many folks say exactly what was on your mind. So just kind of taking Stacey's comment there of not all families need the same thing at the same time. So, you know, even though Triple P has 22 plus programs, it has its one, you know, particular thing that we're conveying, concrete parenting strategies, right? And then sometimes families need the more comprehensive support from something like Parents as Teachers or Healthy Families America or Nurse Family Partnership to support more of their needs. Sometimes getting you know, access to services from that, as Jessica said, the critical time of touching base with mamas when they're very first mamas, you know, and that crucial point, or, you know, in HealthySteps, the idea of the pediatric office being a really trusted provider. You know, so I think this idea, and I couldn't be more excited about this idea of the continuum of care and working across partnerships. We talk so much about, you know, different sectors of the community needing to come together to support kids and families, but for far too long, evidence-based practices have had their little silos, you know, that we've operated in. So just this call in and of itself, with all the partners around the table talking about how we need each other to really support kids and families, is just a huge step. And I give North Carolina just huge credit in taking this step forward and actioning, you know, this in this way. So just excited to be a part of this work and seeing where it goes from here.
Thank you.
Yeah, and I will just echo all those thoughts. You know, families are more likely to stay engaged when they have choice. And so when we have programs that operate and their service areas overlap, then that allows us to give families that choice. You know, Healthy Families has programs where parents as teachers exist, early Head Start, nurse family partnership. And so if folks feel like they want some different type of support, they can present those programs to them and make referrals to them. We're, you know, referral partners back and forth. But sort of alongside that choice that folks have, that continuum of care helps us to provide as much support as families feel like they need. Healthy Families, we have a program in Durham County. We also have a program in Avery County, and Family Connects are in both of those counties, and they serve as a primary referral source for those programs, which is nice because it reduces the chances that folks who want support and could benefit from support are less likely to know about the supports that are available for them. And so those universal programs really provide a large net or portal for anybody to enter into, you know, that ability to look for support. And then when folks are involved in programs, you know, with Triple P, it's also offered universally online. Anybody in North Carolina can sign up and attend those. And we have had family support specialists work through those programs and that curriculum in home visits with families who felt like they wanted some additional support in around parenting and parenting education. And so, you know, it just really provides a real comprehensive framework for families so that when we say we're going to give them support, we can offer that tailored to whatever that family feels like they need and they would like to be in. Yep.
Okay. Thank you. Very good. So then what I'm hearing is across programs is each program is able to individualize. However, each, you know, families have the opportunity to find the program that fits their needs at the same time. Right. Okay. So we'll have Miss Natalie, and then we'll move on to the next question.
Yeah, and I would echo what everyone else said, but one point I would also add is that when you have all of these programs across the continuum, it's a real chance within a community to normalize and destigmatize the whole idea of parent education. That it's not for some parent who's needy or not doing a good job, it's for every parent. And when you have all of these options, that it makes that very clear. It also continues the same language. We all tend to use the same messaging or the same just the same kind of encouragement and strength-based focus. And that creates a whole community-wide level of language, of shared language that benefits families as well.
Thank you. Very good point. Very good point. Okay, so the next question is, in what ways does your model work with or alongside other home visiting and parenting education models to support children? Okay, Miss Natalie is, okay.
I left it up, but I actually do have a thought about this.
Okay.
I forgot to put it down.
Okay.
If we're going to support children effectively, we have to support families effectively. And so what happens in the pediatrician's office needs to, it can't be all of it. Like Patti said earlier, none of us have the end all and be all program that can do everything for families. So with HealthySteps in the practice, referrals are constant. It's part of the job. It's part of the 8 core components of HealthySteps is being connected to community resources and making those referrals. So as I said, what happens in the pediatrician's office is great, but if a family needs more support, they need NFP, they need parents as teachers, they need, and then you have older siblings. You have older siblings from the birth to 3 children whose parents can really benefit from Triple P, or Incredible Years, or all of these programs that I'm looking at across my screen. None of us can do everything, but together all of us can really support families in the communities effectively.
Very good. So again, leveraging.
Yes.
Can't say that enough. Having those connections and leveraging all of our services. Okay, yes, ma'am.
So I'll go, I guess. Some examples of how beautifully this is occurring in the state would be agencies counties that have like the Incredible Years or Triple P. Maybe it's a Triple P level 3 and the parent has that as a choice. Waiting for perhaps an Incredible Years program that might be a month away. And then once they finish the Incredible Years, they might be offered Circle of Parents in the community or at the agency. So it's we all know that you don't stop needing or wanting support when the child turns 3 or when the child turns 5 or 6. So having options, it's really, I think everyone said in the previous question, choice. It's a respectful way to approach families. The more choice they have, I think the better supported they are, and then the families are, and the children.
Thank you, Miss Monica, Miss Amanda, and then Miss Patti.
Thank you. So just, I think to answer the question is, how does your model work alongside with other home visiting models or parenting programs? So one way that Nurse Family Partnership does this is our community advisory board. We invite as many programs and supporters as we can get to come to these advisory boards, but it's not just a way to advise NFP, but it's also a way for us to connect with these partners that have, our clients' best interest at heart as well. And so that's one way we do it. Another way is that most of our supervisors and a lot of our home visitors are on other collaboratives or boards. They might participate in, Healthy Starts, or they might participate on the Parents as Teacher Advisory Board. So a lot of our staff are involved in that way as well. And then we also, because we end at 2 years, when the baby turns 2, we are constantly collaborating and with programs because we want to have that continuum of care. We have to end at 2, but we want to make sure that they're still receiving the resources and the support that they need. So every program, across the state, they collaborate with their partners. And so I know some of my counties have home visiting collaboratives, or it might have a different name, or they might have a collaborative that focuses on early childhood, or, but they try to participate in those as well as everybody else that is involved in those parents and families' lives to have the, same outcomes and collaborate together.
Thank you. And also, I would also add in the various collaborations, we also need to ensure that we have good communication amongst ourselves and amongst our agencies, so that the parents and the families will also not have an interruption of services. Because if there's a lapse in communication, there could be a lapse in services for our families and children, and that's not what we want.
Yes.
So, Okay. All right. So our next question is, how could the coordination and collaboration among models or programs be strengthened to promote the best support for children and families? Okay.
Well, I'm going to jump.
Yeah, we'll go in the order that I see you.
Okay. So is that me?
Yes.
Okay. Sorry. I'm just going to jump in and say that this panel is great. And I know we all work together well. But I think how this work can be improved is to make sure that it gets to all levels of the work that we do, down to the home visitor or the family support specialist or whoever is on the ground in the homes working, making sure that they are aware of all the supports available to their families and how to get connected with them. And sometimes I see that doesn't always happen smoothly, and not by any bad intentions by any stretch of the imagination, but that, as I mentioned, we have underpaid staff that are trying to get the job done, and they're focused on getting their job done and might not be aware that there are other organizations and agencies that can help get that job done if they reached out and worked together. So building those into all levels of programming would be my suggestion.
Thank you.
Yeah, and just to sort of build on what Patti is saying, collaborative efforts like this, I have high hopes for the system building work with home visiting and parenting education that have been working on and are really jumping into now with the system. But making sure that these types of activities are at the local level. Collaboration is a different set of skills than providing home visiting and parenting education. And so making sure that folks at the local programs have support in developing and enhancing their skills in that way. And then being able to change funding structures. There's been a lot of things in the past, particularly funding, that have made folks look at each other as competitors as opposed to collaborators. So continued education with funders about how they can encourage and build collaboration into that funding process as well. And then there has to be that national piece of it. Models in the past have looked at each other as competitors as well. So activities like the National Alliance of Home Visiting Models is a huge step forward in building that collaboration at the model leadership level, because that trickles down. So I think for us at in the state, trying to make sure we push that collaborative effort up continually to the federal level and national level, and make sure that we are helping promote that at the local level as well. And again, remembering that those are different skills than folks need to deliver real quality home visiting and parenting education services.
Thank you.
Mark, I was right about to say about the national level and our national offices being willing to collaborate. HealthySteps lives under 0 to 3 umbrella, and 0 to 3 hosted a collaborative effort and developed something called the Hand in Hand framework, which you can find on the 0 to 3 website. But it is a great example of how models can collaborate and work together to support families. And then at the local level, I would also say that you have to have some kind of communication. So as Mark said, the collaborative skills are a whole different set of skills than the actual direct service work that's happening. But there has to be some kind of framework where if nobody in the pediatric practice knows that this family is also receiving one of these other services, then you have a lot of redundant efforts with referrals, and you don't have the coordination levels that you could have that would support the family more effectively.
Anyone else would like to add to this question? Okay. Okay, now we have one last question. And for the last question, I'm going to pose this to our panel, but I would also like for the participants to also think about this question from your perspective as well. What is your dream for the future of home visiting and parenting education supports? I love how those hands just went flying up. Very good. All hands are going up. And I'm sure the chat is going to be on fire. So, okay, Miss Amanda, and you all just take it away.
So for me, that's a very easy question to answer. Nurse-family partnership is not my dream. However, having every family in North Carolina being able to access a home visiting program, or maybe not a home visiting program, but a program or resources, services that they need to improve their family and, you know, their outcomes in their life. So of course I would love for it to be nurse family partnership, but it's not the perfect fit for everybody. So that's my dream, is that every family in North Carolina would have access to a program that best fits their needs to improve their outcomes.
I'm going to be curious to see the themes in these answers, but I would say for me, my dream would be that there's a universal system that is sustainably funded, that there's a coordination of care where families just get supported and they receive the resources and services they need. They have resource navigation to connect them to things, and it's smooth and easy for them. And it's just how we support children and families in our community is destigmatized. We can access the care. There's not limits to it. We just kind of lift up the needs of our family and care for one another. And I think that would be really special.
Yep, and I would repeat all that folks have the access, the availability, and the choice. That's sort of my subpart dream. My real dream is that we get so good as a country integrating the supports families need in the culture that our policies like family leave and everything else that we do get so good that those social determinants of health are not issues anymore, and that we just totally outgrow the need for home visiting and parenting education. That's a pipe dream for sure, but I think it's one, you know, we can at least shoot for and get as close to as we can.
And I'm going to step in there for a second, kind of elaborate and go kind of piggyback on that one for a second. Thinking about that pipe dream and our families, we have to also remember that in order for all of these dreams to happen, who must have a seat at the table? Everyone should shout this one out. Our families, those that are impacted by our dreams, our goals, our mission, our families that are impacted by our mission, our goals, our steps, our families must be at the table. And we heard from our families earlier today. We heard from our mothers that were on the panel and some of our fathers that weren't there, but were also impacted as well, right? So, you know, if they're not there, then why are they not at the table? We have to, as leaders, we must ask ourselves, if they're not at the table when we're making these decisions, then why are they not there? Okay, so let's always kind of think about that, okay, during our collaborative meetings and breakfast or luncheons, whatever we're hosting. So in order for those for these goals to take place and for our dreams to happen, we have to have those that are most impacted telling those stories. And who would be most impactful telling those stories? The families, the parents, the guardians. And I like to say families, because when you say parents, that's, you're thinking biological. But when you say a family, that could be a godparent, an aunt, an uncle, versus just a biological parent. So kind of expanding on that. So thank you, Mr. Mark, and I'll go to Ms. Stacey.
Yes, thank you, Dr. Chance, for really bringing the focus back to the parent voice, which is really so much about Circle of Parents. So, I mean, again, just a really critical component, I think, to all of our work is ensuring that that parent voice is lifted up and it's part of decision-making at all levels. And so I was looking back at the vision for Circle of Parents, and I'll just leave you all with this because I feel like with this specific question around kind of my hopes and dreams, when I read the vision statement for Circle of Parents, I thought, wow, this is my hope. This is my hope for the future of families, not just in North Carolina, but across the world. So here it is, a world where all caregivers have the knowledge, the skills, and the support to raise strong, resilient, and happy children.
Well, that really says it, Stacey. Thank you. I think you touched on it. That's just beautiful, and that's what I would want. I would want families to feel supported, and for sort of families to come to the idea, and I can't remember who said it in the beginning, it is normal, a normalizing of it is normal and great to reach out for support, a culture of that, and a culture of supporting choice for parents and families, for families to get what it is they think they need at the level they want. And also, I mean, I'm agreeing with the comments. I'm looking, it's hard for me with the Zoom to be looking, but I am seeing, and I've heard it, is support for the practitioners in whatever way that means, implementation support, money, supervision, and any way to help them develop and continue to provide quality service.
Excellent, excellent, excellent points. Thinking about secondary trauma, again, we can never forget about the practitioners and secondary trauma. So going back to Mr. Riggins' session yesterday and the practitioners. So thank you for bringing back that point. Thank you. Okay.
I think I'm next, Dr. Chance, so I'll
Yes.
go ahead. I would love, my dream would be that the mindset shifts entirely, that nobody thinks of this as an extra. This is essential for strong families so that we have strong communities, so we have a strong world, that we all expect that parents are supported and that the people who are helping support parents are paid. Someone put in the chat about adequate pay. Our values are so upside down as far as what we pay for and what we value and how we advocate for funding that's appropriate for the good of children and families. And my dream would be that the child care providers are paid, and it all goes from there, that they are paid more than the college professors, because the college professors have nobody to teach if the child care providers aren't doing a good job. So I think that if we could, they don't need to make more, but they should make as much. They should be equally valued. And so that would be part of my dream. It's an expectation.
Thank you. Hey, Ms. Patti, and kind of jumped around on me. Okay. Okay.
Well, it's hard to follow up with anything new as far as a dream, because I agree with everything that everybody said. But as we approach the Super Bowl, I'm thinking, boy, wouldn't it be cool if early childhood was as important as the Super Bowl and, you know, valued that highly? And gosh, what a different world it would be.
Yes. Yes. Priority switch, right? Thank you. Okay, Miss Sara.
I love all of these thoughts. And as Stacey was saying what the mission was for Circle of Parents, that's where my head went with this dream. We've just kind of in the last year gone through a, let's just rethink as an organization for Triple P, what is our mission? And at its core, it's that each child gets the opportunity to thrive. And in order to do that families have the knowledge and skills and the confidence, that they need in supporting that kiddo. And in order for families to do that, the communities are equipped, and that includes our practitioners equipped, to be able to do that. But Dr. Chance, I'm also, with your very strong point that, families have to be at the table contributing to what they need, and having, us sitting around the table can't say what it is that each family needs for that kiddo to thrive, or that family to enjoy the experience of being a caregiver or being in a parenting role, whether you're a bio parent, a resource family, a foster parent, a support for that family. So I think that's, where we land is just the idea of building this next generation that can thrive, where each and every kiddo is given that opportunity to reach their potential, and each and every family is given an opportunity to enjoy the experience of being a family. Not that it will ever be perfect. Realistic expectations. There are hard times, and we're all going to have hard times, but that everybody gets a chance to enjoy, that experience, and then our communities thrive. Because we've got a graphic that we talk about in Triple P a lot about why every single partner in a community has an interest in parents being supported. Patti, for some of the same things, and Natalie, some of the same things that you said in the priorities for Natalie, particularly that our college professors don't have anybody to teach if we're not, if our kiddos aren't supported, at that young age as well. So. Great points, everybody.
Yes, great. So this has been really good. But I do have a question. I wanted to open up the floor for the participants. So if anyone in the audience that have question for the panelists, if you could put your question in the